Thank you everyone for attending what veterans need to know about Medicare. Many veterans are unaware that the Social Security Administration doesn't recognize VA healthcare as credible health insurance. When veterans turn 65, they must sign up for Medicare Parts A and B, or they will incur a late penalty if they try to choose Part B later. Veterans on Tricare are clearly told they must sign up for A and B, but veterans getting health care through the VA frequently make this mistake. Kelly Hudson is an Army veteran and Navy retiree. She leads a team of volunteers who provide free, unbiased Medicare counseling to seniors in Thurston and Mason counties.
Hello, hello, and thank you for having me here. Basically, that little synopsis was the whole presentation in a nutshell. Hopefully, it will make more sense to you as I go forward into this. So let me see here. Okay, what is Medicare? First of all, quick and dirty. Medicare is health insurance for people age 65 and older. It's not optional. We actually have to sign up for it once we turn 65 or as we're about to turn 65. Some people under 65 who are disabled or have end-stage renal disease or Lou Gehrig's disease, they might be on it earlier than 65. So why is this important? Okay, it's important because there are different parts to Medicare. And everybody, no matter who they are, have to sign up for Part A, at least the minimum hospital insurance, right? But if you're still employed, and there are a lot of folks who are 65 and they're still employed, and they have benefits, medical benefits, you know, for the doctor's visits and so forth through their employer. If you have that and it meets a certain number of things, like the employer has to have at least 20 employees, you know, a large employer with insurance benefits, then the Social Security Administration, where you sign up for Medicare, will say, okay, you're all right to not have Part B. So let me explain what these parts are. Part A, think A for admitting. Okay, A is the hospital insurance, just in case something catastrophic happens. Part B is the medical for doctor's visits. And then Part D is for prescription drug coverage. And Part C is where the private insurance companies come into play. If you choose not to do the just original Medicare A and B, and do a Medicare Advantage, that's where you would have like United Healthcare or Kaiser or one of those. All right, so these are your options when you sign up for Medicare. You can either take the left-hand route of just sticking with original Medicare A and B, and then you add drug coverage if you need it. And if you want to, because A and B don't pay for everything, like vision or dental, you might add a Medigap plan. Think of that column as going to a restaurant and buying a la carte. I'm going to pick out my entree, and then I want this side and I want that side. Some people just say, hey, it's easier to just do a Medicare Advantage plan, which is Part C. It's combining A and B. And you can choose one that has prescription drug coverage, dental coverage, that sort of thing. So those are the two options. Here you go. So, like I said, you have to enroll in Medicare, and it's not automatic. If you're on Social Security, by the time you turn 65, it'll be automatic. But most people aren't. You know, not everybody is. So something to be aware of. Here's the important thing, and the whole reason why I wanted to talk to you today. Like I said, if you're actively working, you've got an employer plan, you might not need Part B. Check with your benefits administrator, make sure that it's creditable health coverage, okay? Even if it's your spouse's plan and you're covered by your spouse's insurance, you might not need insurance. But if you're not actively working, you don't have any insurance coverage, and Apple Health does not count, you have to sign up for Part B. Basically, Medicare is set up to make sure that you have hospital and medical coverage, no matter what. And the important thing is, let's go back to that. Okay, so here's the important thing. Creditable health coverage. The Social Security Administration does not consider VA healthcare as creditable health insurance coverage because it's not health insurance. It's healthcare. Don't ask me why they consider this. Yes, even though, I'm sorry, let me see that chat there. Even though VA healthcare qualifies under Obamacare, yeah. Same requirements for veterans on SSDI. That's Social Security Disability Income. It depends, I guess. It depends. Do you get health coverage through SSDI? If you do, then it would be considered creditable health coverage. What I've run into since starting this role last September is veterans coming to me who had VA health care. And so when they signed up for Medicare, they just signed up for Part A. They said, I didn't need Part B, I had health care. Not according to the Social Security Administration. So if things change later, like you move too far away from any VA healthcare facility, and you decide that, okay, now I'm going to need Part B, and you go to sign up, they're going to charge you an astronomical amount of late penalty every month for the rest of your life. So that's what I wanted to warn people about. If you think there's any chance at all that you might move away from a VA healthcare facility, or it might go away, or you might lose those benefits, maybe if you get downgraded in your disability or whatever, better to be safe than sorry, and just sign up for parts A and B together when you turn 65. That way you'll have the typical premium. And here's where you have to decide. The typical premium in 2025 for Part B is $185 per month. Do you want to spend that thinking you might need it someday? So for this gentleman who came into me, the first veteran I talked to, he was going to be charged like $500 a month in order to have Part B. And I called the local Social Security office. I get a staff line so I could talk to them. And I talked to a supervisor, and she said, yeah, he didn't sign up back when he turned 65. And so we charge a late penalty every month since then. And I said he didn't need it. He had complete health care through the VA. Nope, we don't recognize it. But oddly enough, they recognize it for prescription drug coverage. So isn't that interesting? They consider that you have prescription drug coverage if you have the VA, but not medical. It does not satisfy the requirements for Part B. So that is my warning to you. VA health coverage, according to the Social Security Administration, and that's where you have to go to sign up for Medicare, does not recognize it. Okay, and when I talked to the VA, federal VA about this, okay, I signed up for Part A hospital when I turned 65. I'm actively working. Am I okay? Yeah. So if you have, Colleen, if you have healthcare coverage through your employer and you use VA as secondary, that's fine. That's totally fine because you have creditable health coverage through your employer. That's the important thing. VA does not work with Medicare at all, the way it does with Tricare. So for those of us who are retired, like we're warned when we turn 65, Tricare changes to Tricare for life and it works as a secondary insurance to Medicare. They work together very well. VA healthcare does not. So at least I know that because Tricare warned you. But when I signed up for VA healthcare, they didn't say, oh, and by the way, this is not going to satisfy Medicare. So I just want to make sure that all veterans know this. I've asked if I can put up some flyers at the VA American Lake where I go, and they said no. But I talked to the patient advocates there and some of their folks, and I said, please, please, please tell them if they're getting anywhere near the age of 65, let them know. It might be better safe than sorry to go ahead and sign up for Part A and B. Okay. Any other questions about that? I kind of went through it quickly. I know Medicare can be very confusing. Oh, new message. Note to self, Tricare for Life works in place of Medicare Part B. I only need Part A. No, Gary, not the case. For Tricare for Life, you have to, it's a requirement of Tricare for Life that you sign up for Part A and B. Tricare for Life works with it as your secondary insurance. Tricare for Life, will pay your copays, it'll pay your deductibles. So really, you'll have very little out of pocket except your Medicare premium, your basic Part B premium. We can't get around that. But VA is different. VA will not work with them, and they don't warn you. So you need to, new note to self. Tricare for Life means sign up for A and B. Yes, absolutely. And I think, Gary, in case you forget that note to self, I think they'll make it very clear to you with Tricare when it's, when it becomes Tricare for Life. Hey, you've got to sign up for Part A and B in order to get Tricare for Life. But VA does not tell people that when they turn 65. Hey, by the way, if you're using our healthcare, only our healthcare, it's not going to satisfy Part B. You need to sign up for that if you think you might need it in the future. It's just a better safe than sorry thing. Who knows? How does that work with deferring Part B while working? That's okay. So Veronica, great question. What you would do is if you put off signing up for Part B while you're working, you have credible coverage through your employer. When you're getting ready to retire and not work or have their coverage anymore, then you have, I think it's like you have a special enrollment period where you can then enroll in Part B, saying, okay, I'm quitting my employment. I no longer have coverage through them. I want Part B. That's when you'll have to make sure you do that, because the VA, which has been your secondary right now, is not going to count. So yes. Yes, you do have to notify Medicare that you're deferring, and it'll ask you, I just helped somebody sign up yesterday. It'll ask you, do you want to sign up for Part B? And you can say yes or no. And do you have healthcare through your employer? And that's really the kicker, is that they don't consider VA healthcare as health insurance through an employer. That's kind of the kicker there. So just say, yes, I have health insurance through my employer, and I've been working there. You'll have to say, how long you've been working there, and are you still currently working there, and so forth. So yeah. Oh, and Kathy, I had to have my ID renewed 3 months before I turned 65 to show that I had Medicare. Kathy, was that your military ID? Do you have Tricare? Is that why? With military retirement, yes. Okay. Okay, yeah. So when it comes to retirees like us, they're kind of looped into that system, and they're aware of that Medicare, interaction. But VA doesn't. It's just kind of its own separate entity. So I hope that makes sense. I hope I didn't just confuse you. But yes, I wouldn't have had any clue otherwise either. I was arguing with the people, the person at Social Security on behalf of this veteran. And until she said, no, it's not the case. We do not recognize it as employer health care, and we get this a lot. And that was the warning bell to me. Ding, 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 they get this a lot, which means a lot of veterans are making this mistake. So please spread the word. If VA healthcare is your only healthcare, when you sign up for Medicare, you better sign up for Part A and B just to be safe. And that is my 15 minutes. Thank you so much for joining us. Here is my contact info. If you need any help or you have any follow-up questions, 586-6181, extension 122. If you have any follow-up questions, you are welcome to reach out to me. And or if you need any help with Medicare, I will help you.
Thank
All
you,
right.
Kelly,
Thank you
for your presentation, and thanks to everyone who attended. I've posted a link to a feedback survey in the chat. And the next webinar is at 11, called Get to Know Your Timberland Regional Library.
Thanks. Bye, everybody.